Can everyone see it? My presentation?
Not yet.
Yes, yes. All right. Right. Thank you, sir. Thank you, sir, for giving me the chance to present over here. My name is Gaurav, and I'm a psychiatry doctor. And currently, I'm practicing in northern part of the India, in Ludhiana. And I'm also like unlike other people, I couldn't get a chance to go through. I just got the anecdotal evidences, and I just couldn't get the chance to collect a lot of evidence for it. But what I'm going to do is going to explain the situation, what is going on, especially when the war in context of the mental health, and I'm just trying to make some sense out of it. So, so what happens in war is that, you know, it's like, it's there's a sudden change in the environment. It's quite easy to start the war, but it's very hard to stop it. And then there's suddenly change in the environment. Whatever was normal is not normal anymore. And war has different, you know, presentations in different groups. Commonly, the war is divided into two kind of the psychological effects of the war is divided into two main groups. The groups with the militia, the army, and then there are civilians who get impacted with the war. And what I'm going to do is I'm just going to take some of the examples, what are going on currently, and then we are trying to make the sense out of it. Like there are different contexts in which the war is going on, like different situations in which the war is being presented in front of us. Like, for example, India has seen major skirmishes since 2021, since Galwan and Pahalgam was the last one. And Ukraine war, it just started in 2022 and it's going on till now. And then there's Israel and Palestinian war. And even in the Indian war, also I'm just going to explain what are the special things which we saw in Pahalgam, Balakot, and Galwan. And then we are also going to understand the role of the psychiatry people and what is the role of a psychological first aid, which is quite important in the war situations, and why everyone, the psychiatrists, the psychologists, and everyone needs to be trained into this kind of situation. In India, we know that there are two ways in which the wars present. Full-scale wars are rare in India, but generally there are border skirmishes and then there are insurgency, the proxy wars. But Ukraine just saw the full-scale invasion. It saw trench warfare, massive displacement of population. Palestine, it saw it is seeing a prolonged siege. All right, even people are getting displaced, and there's a war of narratives also which is going on. And it's also the intensity of the combat and the displacement of population, which is all causing a lot of problems. And some of the aspects are related not just to displacement, it's related to the refugee situations and also the ongoing war which is going on. So there are a lot of things which are going on, and even the healthcare system which used to exist before, it doesn't exist anymore, especially when the war is going on. Generally, there are some of the disorders which Dr. Whipple already covered, like, for example, the PTSD, acute stress reaction, then depression and major depressive disorder, if things get prolonged, anxiety disorders, panic attacks, even the veterans, afterwards, they are not able to overcome that trauma, like Gababate says, and they start taking substances. And people are suffering from adjustment disorder, especially the women. And then then there are some emergent phenomena if some veteran, he loses all his friends, then they develop the survival guilt that leads to suicidal ideation. And then now the ICD-11 also recognizes something which is a complicated form of PTSD, which is complex PTSD, in which the identity also get affected, and the person has emotional dysregulation. And so all these things have been becoming prominent. Like, for example, if we saw World War One, people used to have shell shock, all right? And then in the World War Two, people started having combat fatigue. Now, humans have evolved, perhaps the human psyche has evolved. So we are suffering more of PTSD situation. In India, there are some situations, especially in the war-related situations, the wars are generally fought at higher altitudes. Like, for example, usually what happens is that usually it's the borders are on Himalayas. And because of that, the Indians, they start having the depression because of the temperature. They have sleep disturbances, the Indian soldiers I'm talking about. And then they are like also like they start having the cognitive deficits. And the other thing which we are seeing is like high altitude cerebral edema, HACE, which is also seen in the Indian population. And then the people out of the influence of that, they also start hallucinating. Like sometimes they also see things which other people do not see. And that's called as like third person phenomena, which we are seeing in the Indian soldiers. Again, this all is anecdotal. I've just got from some news articles. I was not able to back up these all things, but I just got this information. And then in India, also like it's hard to get care because like still people have like they stigmatize the mental health, and even the war also the trauma also gets complex because like it's not just survival guilt because of which the people commit suicide, or perhaps they're not able to adjust to the civilian life. Sometimes there's also the fratricide rate is also quite high. A fratricide rate also affects the war. For example, like the people die in the friendly fires. That again, like, complicates the trauma which the person is suffering from. All right. And then, like, there's also like a transgenerational trauma about which Dr. Whipple talked about. I'm going to talk to you about that's about the displaced population, not the people who are suffering from the war, the soldiers. All right. Like let's just take about the situation about Pahalgam attack. What happened was like people went there in Pahalgam, and there was suddenly an attack, and then like they killed the men, and then after that like the families were devastated, especially the women and children. So they were like they initially they had that shock, and after that they had survivor's guilt, and then even like they were numb in the beginning, and like even like there were instances like when children had bedwetting, they had mutism. All right, so all these things they manifested themselves in Pahalgam attack which just happened. Although the government they put the thing like it led to a major war at the other side as well, but the thing is like damage is already done. And then there's like the Balakot airstrike which happened in 2019. And again, like I'm not talking about the politics of it, but I'm talking about the things which soldiers suffered from, and I'm just talking about the phenomena what they suffered from. Like one of the thing was like there's something called as combat readiness syndrome. All right, like it's a kind of like a kind of again a youth thing which is used in the news jargon, in the news articles and everything. Like people are they are always ready for the fight. So that's the combat readiness syndrome. And what about the people who are watching the news? They suffer from something which is called the civilians. They suffer from something which is called as vicarious trauma. What happens is that if there's a news, the negative news which keeps on, getting broadcast in front of you, you're always scared of it. So that's called as vicarious trauma. And then like, there are some of the things which are like there in the population which is going on. All right, because of the war. And then there was another war which India saw at the time of COVID, and that was Galwan clash. And like there were like the civilians who died, and because of that they suffered from the hypervigilance syndrome, and even like high altitude related war uh, effects they could see. And even like people also develop some another special syndrome which is called as barrack syndrome. Now, what is this barrack syndrome? Is like when you stay in your barrack for a long period of time and you do not interact with the other people. So like you're isolated, and like you have those effects in your body for a long period of time, in your mind for a long period of time. So again, that thing which was seen in the Galwan clash, right? So I'm just like talking about some of the wars and just comparing them, like the Indian wars, like the Balakot, Galwan, Manipur, everything, and Ukraine war and Palestinian war. The wars, the Indian, like, the skirmishes, they just came and then they went back. So they just led to PTSD, stress reaction, depression, survivor's guilt, and so on. But Ukraine war, it's something which is going on. And Palestinian war has led to displacement. And it's not just going to lead to displacement, it is also going to lead to a transgenerational trauma, which is going to get passed into the generations. All right. India does have some of the things, like they have like the military psychiatry units, AFMC, even the telepsychiatry aid is available, NIMHANS is available, but other countries they are actually kind of losing their infrastructure. All right. So this is something which is going on in India. So generally, like I've just discussed about like the difference between the different situations, the different wars, and then there are also children-related trauma. Like for example, the children they get develop this kind of attachment disorders, all right, in beginning, and then adolescents they have problems in the school, and people in like when they are in their teenage they have difficulty in forming relationships with someone else because they're so distraught. And then there's something which is also called as transgenerational trauma, which is often seen in the Jews and now in India also in context of Kashmiri Pandits. So what they do is like, like first of all, the trauma, it has the epigenetic effect. And after that, when the trauma gets passed into the next generation, like they might not be as normal as jovial like you are. And they also might start suffering from some kind of psychological illness, or perhaps they're more vulnerable. All right. So that's something which is a transgenerational trauma. And it requires long debriefing, long, like, the cognitive behavior therapy. The things which have happened in the past, obviously you can use EMDR, but these kind of things, they require this trauma debriefings and so on for a long period of time. Then the skill which everyone, perhaps like everyone should know is a psychological first aid. Like, for example, like if a situation happens when someone has just faced the trauma and is in a state of shock, what you need to do, all right? You need to have those skills. So what are these skills? Like the person might present with shaking hands, rapid breathing, tearfulness, and they might have concerns about the family and they don't know whether the families exist or not. All right. So what you need to do is like, first of all, you need to calm the person down. All right. You get that person engaged with whatever the help is available, provide the safety and comfort, stabilize the person. All right. Get the information, whatever is available. All right. Don't give too many hopes, but just try to give the information which is available. You try to link to the social supports which are available, even if like someone has a cultural understanding, Hinduism or Islam or Christianity or whatever, you can just tell the people, give them the beliefs which give them comfort. Because like that time, it's not like you don't have the insight, all right, and you can do things which are not under your control. So these are some of the things which might, affect yourself during the time of which you might have to do, like for the time the person gets stabilized, and then you get them connected to the services, so that they go through the stages of the stages of perhaps like meeting their loved one or stage of the grief, but they get the time to process it. All right. So, and it's not like that. The therapies and the debriefing, and they need to talk for a long period of time. So these kind of things, they actually work. And even nowadays, like people are also using the ketamine treatment because like that, that helps in processing the trauma. And so that also helps in, like reducing the effect of the trauma if you combine it with psychodynamic psychotherapy. So it's important that we need to know about how to handle these kind of situations, but we also need to get prepared about all these things. So, well, thank you so much for listening to me, and thank you so much for giving this chance to me. Thank you so much, Sujit sir, and thank you so much, Dr. Rain.
Thank you so much, Dr. Gaurav. Thank you so much, Dr. Vipul, for the interesting presentation. This is something very important that everybody can relate to it. Now, if you see the global scenario, the most of the countries, they are either directly affected by war or indirectly affected by war. So it is almost every corner of the world is affected by the consequences of the war. So I will invite any questions from the audience. You can put your comments or questions directly in the drop box, in the chat box, or you can directly raise your hands and you can ask the question.
Can I ask, yeah, so may I ask, just give me a second.
Yeah.
The question is, I think this Gaza war or the Palestine war is very special. And, I think the world has never seen anything like that. I think we have seen whatever different types of wars, but I think it's like a war of whatever against one country and against civilians. And so I think it's quite unusual in the way. And I don't know you mention the future. How will they manage something like that? And I think you have, we had this Halabja discussion yesterday, and so the question is, why is it so difficult, and why is it so special, and why is it that people who had possibly more or less the same experience from the Germans and do something different or do something similar?
So I think like it's different because because they don't have the home anymore, because like they don't have anything to turn back to. So one of the things is that, and it's very hard because like although you might criticize your country, you might criticize your home so many times, but if you don't have a home, that generation can never process that trauma itself. And the Jews have been experiencing that, and they are not able to overcome that for a long period of time, and perhaps they will never overcome that, and they might lead to some kind of these permanent scars on them. I know it's like I wish that there was a hope for this, but I wish that things became all right, but that's just a wishful thinking.
And it is also very
I think
difficult
it's a good question, sharp and important. Short version, like in Halaba, and there is the use of the chemical agents and the state organized mass targeting was done. So probably it was taken to a much longer period of time than the other wars. So probably it is different from that. It could be the reason.
Any other questions?
Yeah. I'm looking at it from the root cause, religious, spiritual angle. What can we do about that going forward? That would be my question. Otherwise, this war may continue forever.
Like spiritual during the time of therapy, post-war therapy, and during the time of therapy, that we can use the use of the spirituality in the during the therapy, then it can be helpful because it renders hope and also optimism in the person, and in the nature of in the energetic context, they can tell about all these in the energy realms, and they can elaborate all these things in terms of God and other things, like if whatever the knowledge and whatever the experience they are having during the war, they can during the time of therapy, then they can explain all these things in terms of spirituality or religious thing, I think.
I think like the thing is like you have to have the cultural understanding, but the most important thing, which I think is like try to make people comfortable first. And why these wars do occur, it's perhaps the human nature. All right, like first of all, there was like people were like bored of dictatorial regime, autocratic regime. They wanted democracy. Then they fought against the dictatorial regime and they went into democracy. Now again, like people are bored of democracy and they want to go back into the dictatorial regime, because like currently all the leaders around the world, they're all they are almost like autocratic kind of people. So this is the situation the world is in right now. And again, like this, like it's like human nature, like like perhaps like everybody wants to like make sure that they lead the world, and it's the fight for supremacy. It's not about religion, it's just somehow like human nature. And but the thing is like it's colored by these weapons and everything. It's all going on, and that's why like these all they generally, like for example, I just give you an example, sir, if I may, just in 1 minute. Like for example, like when there was the previously, there was like this all started after COVID. what was COVID basically? It was a imbalancing act of the power. Like before that, like the Western world used to be superior and the Eastern world used to listen to the Western world. And when there was COVID, there was shift in the power. And to rebalance that power, everything started. Even before that also, like when there were other pandemics also, like SARS virus and all. That happened, there was again the imbalance in the power. And again, people wanted to preserve their power. And in this act of preserving power, there was a war. So it always happens like perhaps when they learn that how to coexist with nature, till that thing does not prevail into the senses, these things will keep on happening. So that's something which seems to be logical to me.
I think Dr. Param is pioneer in the field of spiritualism in psychiatry. So he can tell best how can we help the war victims and the soldiers and the poor, like the women and like refugees. How can we help in terms of spiritual context?
Yeah, thank you, Vipul. Vipul and I we have been collaborating a lot. Thing is, in a given moment, after the suffering has happened, after the injuries, I don't have anything for that. We have all those things which are existing in the current world, treatment for PTSDs and various and sociological supports and all for those who have lost homes and things like that. But I'm thinking of as a prevention of a next layer of war, next episode of a war. There has been episodes of war in between Palestine and Israel ever since it came up in 1947. It's not post-COVID, Gaurav. The thing is, what we need to do, there's the war between Israel and Palestine is primarily religious, spiritual. It's nothing to the fight for land is just superficial. So as we have seen, there will be no. I'm probably going into another area of political discussions, but we cannot escape it. We cannot shrug it under a carpet. The thing is, they are thinking of a two-state theory, but two-state theory will never last long. It will continue just as what we have now between India and Pakistan. It will continue forever. So the reason underneath the two-state theory is differences between you and me, your religion versus me religion. What do we do to solve that problem should be the focus for us. My next presentation is going to be on that. Evidence-based spirituality is needed. That's where I will talk. But as I was listening to you, Gaurav and Vipul, I was thinking that we should probably put together another symposium for ANSIPs. So I just texted Vipul. We'll work on it. And others who are interested, we can join and make something much more powerful. This has to be brought. Thank you. This is a great topic you both brought. I was shocked to see that topic, but I'm now pleasantly surprised. Thank you so much.
Actually, this credit goes to Dr. Sujit Kar. So he has, and Dr. Professor Ryan. So he has asked me to bring something up from. So they are
let's bring both those two people too. Sujit and
they have conceived this idea because when we were doing all these things, so at that time war was going on. So that probably so credit goes to both of them.
Cool.
There are a few more questions in the chat box. Maybe we can take quickly those questions. One is regarding the psychological first aid to the war victims and their family members. And another is with respect to the generational trauma and displacement. There is another question that is interestingly raised by Dr. Surabhi Chatterjee, that is regarding the genocides and uprising recent event like Nepal. Very recently, there is a similar kind of incident that happened in Sri Lanka, subsequently in Myanmar, Sri Lanka, Bangladesh, then Nepal. So a lot of South Asian countries are affected by this uprising and mass killing and political instability, ultimately affecting the mental health of larger public. So not only we are dealing with war and terrorism, we are dealing with other issues which are of similar kind. So do you have any answer to this type of challenges that we are facing right now? How this can be dealt? So briefly, you can answer to this question. Probably this will be the last question. We will be going to the this presentation.
Actually, since we are psychiatrists, we are merely focus on we can merely focus on the psychotherapy aspects or psychiatric aspects. So dealing with war is difficult thing. It is a more a political issue. So as I have told, trauma focused therapy, debriefing, and other therapy can be helpful in that context, and also like the understanding the social and the economics as well as the cultural context of the country that war is happening, so we can deal with the as per the social context and other things. So but most of the literature when we go through, so they have talked about like in the any kind of psychodynamic psychotherapy, like trauma focused therapy, that can be helpful during, and debriefing can be done, but debriefing cannot be done in case of children. So these are the things that can be helpful. Along with that, if they needed pharmacotherapy and other therapy, then we can go ahead with that.
Thank you, Dr. Bipul. Here, Professor Renner, we are missing Dr. Daria Ahmed, who is actually working for this war-related victims through his program e-mental health and psychosocial support for the war victims and those who are affected by this kind of disasters. Maybe offline support may not be feasible for all the individuals who actually need the psychosocial support, but an online support can be delivered to remotely. You can provide those services, those who are remotely located and victims. So this is another interesting area.
I think we should consider another symposium on this issue.
Yeah, we can think of that.
Because
We can work on that.
I really invite you for that, because this is what the Global Psychiatric Association is about, trying to support people in other countries and raise awareness, and sadly we have a situation where war is coming into people's lives, and not just via the media, and some people are really suffering a lot. Anyway, I think
thank you so much. We'll be going to the next presentation. This presentation will be a video presentation by Dr. Juan Gaitan and Professor Dr. S.M.